All right, well, I've been informed that we're getting started here, so I'm looking forward to talking with you guys about some of the work that I do at the nexus of climate and health, and also showcasing some of the work that goes on at the Institute at Brown for Environment and Society, where I had the honor of serving as director. So looking forward to hopefully leaving time for questions and discussion as well. So really excited to be here at this event and really grateful to be included, as I'm just a climate scientist, so you know what do I know? But I am trying to, as I'm going to try to talk about, figure out ways that not only my own personal research agenda can move into that space, but more importantly, we could think about ways to tie the work that faculty and postdocs and students do at IBES, the Institute, to the work that's going on at the medical school and the work that's going on at School of Public Health. So really looking forward to forging those ties in the next years. So I start my career underwater. So I study coral reefs, and I try to use coral records to understand the recent history of temperature trends and extremes in instrument data poor regions of the tropical oceans. And I was motivated because I wanted to try to understand the history of the most powerful climate cycle on our planet outside the seasonal cycle, the El Nino Southern Oscillation, which has its origins in the tropical Pacific. And this is kind of a NASA depiction of the broad area of warming that occurs from the central to eastern Pacific. And the total area of that is more than 3 times the continental United States. So when it heats up there, it perturbs global temperature and rainfall patterns around the world, from Greenland to Antarctica. And you can see all the different events that I've had the privilege of watching very closely over my career, up to and including the largest event on record, which was in 2016. And I should mention that's my kind of research site in the middle of the Pacific Ocean, an island called Christmas Island. And when El Niños happen, they also have a really powerful impact on global average temperatures. So they are the driver for, I call them sometimes the pacemaker of global warming. So every time we have an El Nino, we'll reach a new climate record. That's a given. And every time we have a La Nina, everybody will start to say, well, it's really not so bad, and it's warming rates are going down. And so this is very predictable by now. But in 2016, it was a staggering increase. And it hit the coral reefs that I work at very, very seriously. And this is a before and after across those 10 months of accelerated warming and record-breaking warming. So at the end of that, we lost about 90% of the reefs that I've been studying for over 20 years, which was a devastating loss both for the island ecosystems, for the subsistence fishermen that live on these islands, and also for the broader research agendas that many of us have been working on to try to advance coral resilience in the face of ocean temperature rise and acidification. And more to the example of the nexus in climate and health, I also was subject to chikungunya during that trip when I was working that El Nino event in particular. And I think I love to tell this anecdote. My graduate student got dengue, so we were the 1-2 there. And you're at the research site, it's very warm, and it's pouring rain down on you, and there are standing pools of water everywhere. This is normally a desert island with like 3 palm trees on it because of the location of cold upwelling driven by circulation, and that drops away, and it gets to be this bathtub, and it gets very rainy, which is why it's such an incredible place to study El Niños. But I'd never experienced the kind of record-breaking rainfall that the island had that fall. And you're walking around and all the clinics are overflowing with sick people, and there's really no medical facilities on the island, and you're going, I just like drive to my boat and get on my boat and do my research. And then I was on the plane back and I spiked a huge fever, and I thought, that's a bummer. And then I had a very serious fever, and I landed in the hospital, as did my graduate student, and actually had to diagnose myself 2 years later because I'm going to finish this anecdote, I promise, but the infectious disease doctor basically told me I couldn't get chikungunya at that location, right? And so the public health guidelines for triaging my illness were completely failed because of this record-breaking event was tipping this desert island into a new region of risk for mosquito-borne illness that was not previously appreciated. So I ordered him to do the antidote test for chikungunya 2 years later. It came back and he said, oh, you'll be fine, it's positive anyway. So I'm like, what? Okay, anyway. Anecdote aside, that was my first personal foray into the space of climate and health nexus. But I wanted to remind us that today we're in the middle of a pretty serious El Nino event. It's not as record-breaking as the 2016 event, but it's the second largest event of the century so far, and the largest event together with the 2016 event in over 20 years. So it's a big event, and it's causing right now a large spate of anomalous global health anomalies. Places are rainy where it usually isn't, places that are warm where it usually isn't, and including, of course, extreme events like droughts and floods that have their own devastating impacts on the health infrastructure and livelihoods of many, many millions, hundreds of millions of people around the planet. And of course, not surprisingly, we've also spiked a new global temperature record in 2023, as evidenced by this graph. And in 2024, we'll almost surely beat out 2023 as the El Nino event continues through at least June or July of this year. And the climate and health nexus is not complete, of course, without reminding us about the kinds of extremes that El Nino's fuel. This was the Lahaina fire in Hawaii, which has part of its origins in the El Nino event of 2023, driving really dry conditions, adding to fuel that was available, and also windy conditions on the island, which contributed to the devastation wrought by that event. And 2023 was an anomalous year in terms of billion-dollar classes of disasters in the United States, tallied by the National Oceanographic and Atmospheric Administration as a record-breaking year, 28 such events, billion-dollar events. So the total of these events, cost-wise, is in the hundreds of billions of dollars, but the total cost is, of course, not really depict the most incredible cost borne by lost lives and generational impacts on livelihoods. So I love to talk about climate change these days as a public health threat, an economic threat, and a national security threat. And I also love to remind us how addressing climate change is the historic opportunity to address lingering issues that the social determinants of health intervene in that, and outcomes, to think about addressing our ongoing economic challenges that we have, some of which are intertwined into inequities that could also be addressed. And then, of course, on the national security front, which is also somewhat related to the economic front, we have a historic opportunity to think about leveraging the science to advance on national security. So I just would like to remind people that none of these things are partisan in nature, and that we can all find ways to move the work forward. But today I really wanted to drill home on some of the work that I've been really proud to be involved in, and some of the work that I'm trying to think about really moving forward here, and in some cases already moving forward, as I'll talk about. But this is a staggering statistic from the second assessment report, the sixth assessment report, Working Group 2, on the impacts and adaptation vulnerability for climate change, just reminding us that the statistics of climate losses are already 15 times higher in the more vulnerable regions around the world than in the less vulnerable regions. And so that's just drives me forward. And I love to talk about the fifth assessment report. I think I saw Beth Fussell in the audience, who was a lead author on that assessment. And this chapter, I think, is seminal. And if you're interested in the climate health nexus, I strongly encourage you to go to the fifth assessment report and dig into this chapter in particular to try to understand what we could do to engage communities in thinking about long-term equitable solutions to climate change. And one of the ways I think we can advance this work is super not a shock in this room, but to lean into a transdisciplinary research agenda where we think about combining the scholarship from across different disciplines at a university like Brown, but critically we think about bringing in the expertise of non-academic partners in sourcing the problems and defining the solutions of the research that we're doing. And so this is not easy at all, but it's actually the kind of work that the fifth assessment report from the National Climate Assessment calls for. And some of the examples all of the examples I'm going to talk today are about ways that this work has taken flight, whether it's here at Brown or in my previous roles that I was closely involved with. And then I'd love to hear your questions and thoughts. But the mission of Brown, as redefined by our new of IBES, as redefined by our new strategic plan, really leans into this solutions-driven space and really thinks about it from how we could leverage the engine that is interdisciplinary research at IBES, which is already so strong, thinking about deploying it in this transdisciplinary framework. And I'm going to talk briefly about 3 projects, 2 of which I was directly involved with, and one of which is led by another IBES faculty, to kind of illustrate how these things can take shape and kind of the many ways in which we think about community engagement and partnership in a sustained way for better outcomes at the climate health nexus. And so this room certainly needs no introduction to the phenomenon of extreme heat and the fact that it is oftentimes worse in those neighborhoods of an urban environment where we have low-income communities, often communities of color. This is work by Jeremy Hoffman in Richmond, Virginia, but it's basically like this in every urban area across the country. This was just one of the earliest examples of measuring temperature at very small scales in urban environments, and then basically overlaying those neighborhoods which have been historically redlined and finding a very close overlay, but close correlation between those 2, extreme heat and historic redlining. And so these are ways in which the history of structural racism in this country has actually defined the geography of the places that we live in and other people live in, and of course the vulnerabilities that we're experiencing in 2024 baked into those historic wrongs. And so this, of course, means that to intervene in this kind of issue is to think about the systems approach of the historical lens, the modern day sociodemographic trends that have driven this to be the case still today from a policy perspective, and intervening is a non-trivial matter, let's put it that way. One of the things we were excited to do in Atlanta was to start a project called Urban Heat ATL. And Urban Heat ATL was born during the pandemic, so it's very pandemic friendly because people just get these sensors in the mail that we sent them. They talk to their smartphones and they can walk or bike around their communities, and those data go back to a central database, and then we can get these really detailed maps of meter by meter temperatures, importantly at the height that people move around in, which is oftentimes difficult to get, for example, from satellites. In an unbiased way. So these are some of the community scientists. We've had over 100 engaged over the course of the pandemic who were out there moving around their environments, delivering back this data. And this is just the first several, 9 months of data that we collected. And this project is still going on down at Georgia Tech with Spelman College as a close partner. And so these are the kind of worms that people recover in working around their environments. There's days, there's nights, there's summers, there's winters in this. And there's even some Georgia Tech students who walked into air-conditioned buildings in this. And so moving through this data really requires an advanced framework, including artificial intelligence frameworks we could potentially bring to extract the highest value from this kind of data set. So that's work that I'm excited to have been involved with, and I know there's work that's going on here at Brown on urban heat islands that I'd like to plug into, and I know is going to be important in terms of the climate health nexus here in Providence. The second project I wanted to lift up is one that's focused on coastal flooding in Savannah, and I want to note at the outset that this is a project that I was heavily engaged with down in Georgia, but is also taking flight here in Providence with a new National Science Foundation grant led by Manu Di Lorenzo in Deeps here at Brown, and aggregating emergency planning and responders and city officials and county officials. There's public health faculty, some of whom are in this room involved. There's AI people involved, so it's really exciting to see this begin to take shape here. So listen to my words with that lens in mind, because I think if you're interested in this work, there are ways to get involved with it in a now term, ground floor level. So this is a project that's centered nominally around technology, which is a water level sensor that's very inexpensive. So I'm fond of saying that the NOAA tide gauge sensors, of which we have 2 here in Rhode Island, cost $75,000 just for the kit, let alone the maintenance and manning and ongoing calibration of those. And these sensors cost $250. So I'm not meaning to place them on the same scale here, but I am meaning to say you can get a lot more sensors with the $75,000 if they're $250 each versus the $75,000 single sensor. And so why is this important? Because flooding happens in a kind of a patchwork way across any given flood zone. And that can be a function not just of the topography of the land, which is we all know, but it's also about the wind direction, where the rainfall is coming from, the storm surge that communities are facing. And it's extremely complex to predict and to monitor in real time because it's so dynamic. And so these hyperlocal sensors, we have 65 deployed down in Savannah, Georgia. We're hoping to get to that level of deployment here across Providence. And I was speaking to somebody at lunch who was just telling me that they're already working on placing these sensors across the community. And so the cool thing about this project is that the technology is actually an opener. So when we started this project, we were very kind of techno-focused. This is a really cool whiz-bang thing. But really what it was, it's a conversation starter across partisan lines. It's a conversation starter and a training tool across generational lines. And it's a way to think about crossing the temporal frame from what's relevant here and now, infrastructure, lives, economics, to the longer term frame of how do we think about resilience and what do we mean by resilience and who gets to say, and some really important questions that don't get asked in Savannah, Georgia, unless they can hold up their prize and say, we are the highest density sea level sensor network in the world, which they are right now. So that's been a great kind of example for me of what's possible, and there were 35 faculty involved, and this is a high schooler assembling a sensor in her engineering class down there. Lastly, project-wise, I wanted to lift up the work of Dr. Meredith Hastings and her work on Breathe Providence, which many of you may know of. I think it's 4 years running right now of them, again, kind of a similar fashion, borrowing on a low-cost air quality sensor, but thinking about replicating that many, many more places than the EPA measures air quality in a jurisdiction like Providence, and working to think about the network design and the data applications as something that's embedded within a community engaged framework, in particular with environmental justice communities located across Providence. So this has been a kind of a big lift, not on the technology side, but really on the kind of the network design and data stewardship and frameworks and funding side and engagement strategies. And there are many Brown students already involved in this, and there are students in the room. There are many opportunities to get involved in this work. So I think it's an incredible example of this transdisciplinary framework that I was talking about before. And of course, I would be remiss if I didn't mention that Brown has just green-lighted a new 3-year initiative that IBES is lead of, but School of Public Health is one of the 4 key partners for, called Equitable Climate Futures. And Equitable Climate Futures is a way for us to think about incentivizing and accelerating the transdisciplinary research that could exist around climate solutions at Brown, using our 4 key strengths as accelerants or focal points for aggregating people together and thinking about the partnered landscape. Climate and health is number 1 on that list for a reason. So we already know we have deep benches in this space. We already know we have a lot of examples of these kinds of transdisciplinary projects going on. So how do we make it bigger is the question, and more impactful, which is really important question as well. Climate impacts and risk assessment, climate policy, and economics. And then I think the 4th thing, which I'm really passionate about, which I know many of you in this room think about as well, is the climate communication, storytelling, and narratives piece. So this leverages, for example, the work of the Information Futures Lab. I see Stephanie there, and other partners that exist across the humanities, the medical school, the School of Public Health, as we think about what does it mean to lean into effective narratives and visioning and strategies for engagement that is so critical to the success of this work. We know that. All right. Oh, and of course, if you're transdisciplinary, if you're going to get money through this, you need to have a non-academic partner. So if you're interested in getting involved in any way, shape, or form, do reach out to me, whether you're faculty, staff, or student. I think there's room for everybody to begin to think about what this could be and how we could come together to make this successful. So, this is a grim statement that we were out of time, but I like to flip that on its head and ask about the opportunity spaces. So how could this be the most consequential decade in human history if we can bring ourselves to a new height of ambition and then act on that right now? That could be the case, and that's what I think about when I think about we are out of time. I think, this could be our moment. And this, in fact, must be our moment. And with respect to higher education, we have this opportunity to think about what is the role for higher education institutions as a catalyst in this space. And that's why I'm in higher education. I think about that not just with respect to our research engines, which I've talked about, but of course the next generation, which needs to learn about this work very quickly, wants to be engaged in it, and in many cases is looking for professional opportunities in this space for the rest of their lives. And so how can we serve them, and how can we inspire, equip, and engage them in this work? And I'll just end by saying that I don't think that we need to think about this just with respect to institutional reform, wearing my director's hat, but we also need to think about this as individuals and how we build relationships to each other in doing this work, and think about it from the personal to the professional as well. So I will end there. Thanks. I know we're a little tight on time, but I think I have 5 minutes for questions, Allison. Yeah, any questions or comments? Reflections? Yeah.
When you were capturing this temperature data, do you also try to capture humidity and other factors that include a richer definition of heat?
Yeah, so the sensors are really bad at humidity, it turns out, which is probably not surprising. Sometimes they're, next to a backpack or something like that. And so we have what we call a scaffold of observational tools that we've deployed across the city. So we can think about the most granular data is coming from the handheld sensors. They're literally not handheld, but at any rate, there's a little dongle so you don't get yourself too hot holding it. But there's those sensors, and then the next level up is a suite of weather grade sensors that we installed. So we installed 25 additional sensors across the city landscape with a strong focus on those areas that we've already seen from satellites, for example, maybe hotter or more diverse in their heterogeneous in the temperature changes that they experience. And then there's, of course, another level, which is working with the county. They monitor 12 really high-end weather stations across the metro Atlanta area as part of the National Weather Service. And so we connected with them to get access to really good wind speed and cloud cover data and all those other, 50 other meteorological variables. And then, of course, there's satellites as well. And so we have students working on thinking about the calibration vertical through that data set and how we could use it intelligently to ask the best questions and get the most robust answers. But it's the data on the ground that those sensors which have really unlocked the engagement for communities that feel like literally empowered by the fact that they can map the spaces that they would like to see in our databases. And they can do that again and again and again in areas of concern to them, like where their children play, where their mom waits for the bus stop, their community center. Those kinds of things are what has been the biggest success for the community science program there. Maybe one or two more if there exist. All right, well, we'll give the time back then. Okay, thanks.